Wellbutrin is an antidepressant medicine that is thought to work in the brain nerves on the chemical messengers norepinephrine and dopamine. Wellbutrin XL is used to treat major depressive disorder and seasonal affective disorder, and Wellbutrin SR is only used to treat major depressive disorder. Indications. Wellbutrin is used to treat depression. It can improve your mood and feelings of well-being. It may work by helping to restore the balance of certain natural chemicals, neurotransmitters in your brain. How to use. General instructions for use. To minimize the risk of seizure, increase the dose gradually. Wellbutrin should be swallowed well and do not crush, divide it, or chew it. Wellbutrin should be administered in the morning and may be taken with or without food. Dosage for major depressive disorder. The recommended starting dosage for MDD is 150 mg once daily in the morning. After 4 days of dosing, the dose may be increased to the target dose of 300 mg once daily in the morning. It is generally agreed that acute episodes of depression require several months or longer of antidepressant treatment beyond the response in the acute episode. It is unknown whether the Wellbutrin XL dose needed for maintenance treatment is identical to the dose that provided an initial response. Periodically reassess the need for maintenance treatment and the appropriate dose for such treatment. Dosage for seasonal affective disorder. The recommended starting dose for SAD is 150 mg once daily. After 7 days of dosing, the dose may be increased to the target dose of 300 mg once daily in the morning. Doses above 300 mg of bupropion hydrochloride extended release were not assessed in the SAD trials. For the prevention of seasonal MDD episodes associated with SAD, initiate Wellbutrin XL in the autumn prior to the onset of depressive symptoms. Continue treatment for the winter season. Taper and discontinue Wellbutrin XL in the early spring. For patients treated with 300 mg per day, decrease the dose to 150 mg once daily before discontinuing Wellbutrin XL. Individualize the timing of initiation and duration of treatment should be individualized based on the patient's historical pattern of seasonal MDD episodes. Switching patients from Wellbutrin tablets or from Wellbutrin SR sustained release tablets. Switching patients from Wellbutrin tablets to Wellbutrin XL or from Wellbutrin SR sustained release tablets to Wellbutrin XL give the same total daily dose when possible. To discontinue Wellbutrin XL, taper the dose. When discontinue treatment in patients treated with Wellbutrin XL 300 mg once daily, decrease the dose to 150 mg once daily prior to discontinuation. Contraindications. Do not use Wellbutrin if you have used an monoamine oxidase inhibitor in the past 14 days. A dangerous drug interaction could occur. Monoamine oxidase inhibitor include isocarboxazid, linezolid, methanol blue injection, phenelzine, rasagiline, salicylic, tranylsopramine, and others. You should not take Wellbutrin if you are allergic to bupropion, or if you have a seizure disorder, an eating disorder such as anorexia or bulimia, or if you have suddenly stopped using alcohol, seizure medications, or a sedative. Do not take Wellbutrin to treat more than one condition at a time. If you take bupropion for depression, do not also take this medicine to quit smoking. Wellbutrin may cause seizures, especially if you have certain medical conditions or use certain drugs. Tell a doctor about all the medical conditions and the drugs you use. Precautions. Drinking alcohol with bupropion may increase your risk of seizures. If you drink alcohol regularly, talk to a doctor before changing the amount you drink. Bupropion can also cause seizures in people who drink a lot of alcohol and then suddenly quit drinking when they start using this medication. Bupropion may impair your thinking or actions. Be careful if you drive or do anything that requires you to be alert. Do not stop using Wellbutrin suddenly or you could have unpleasant withdrawal syndrome. Ask your doctor how to safely stop using this medicine. Some people taking Wellbutrin have had high blood pressure that is severe, especially when also using a nicotine replacement product, patch or gum. Your blood pressure may need to be checked before and during treatment with bupropion. Wellbutrin side effects. Get emergency medical help if you have any of the signs of an allergic reaction to Wellbutrin: hives, itching, fever, swollen glands, difficult breathing, swelling in your face or throat, or a severe skin reaction, fever, sore throat, burning eyes, skin pain, red or purple skin rash with blistering and peeling. Report any new or worsening symptoms to doctors such as motor behavior changes, anxiety, depression, panic attack, trouble sleeping, or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive, mentally or physically, or have thoughts about suicide or hurting yourself. Call a doctor at once if you have a seizure, convulsions, confusion, unusual changes in motor behavior, blurred vision, tunnel vision, a pain or swelling, or seeing halos around lights, faster or irregular heartbeats, or a manic episode, racing thoughts, increased energy, reckless behavior, feeling extremely happy or behavior, talking more than usual, severe problems with sleep. Common Wellbutrin side effects may include dry mouth, sore throat, stuffy nose, ringing in the eyes, blurred vision, nausea, vomiting, stomach pain, loss of appetite, constipation, sleep problems, insomnia, tremors, sweating, feeling anxious or nervous, fast heartbeats, confusion, agitation, hostility, rash, weight loss, increased urination, headache, dizziness, or muscle or joint pain.